Okay, well, good good evening.
Good
Uh,
evening.
how are you this evening?
I'm good. How are you?
I am doing good. Thank you for attending class tonight. And so, what were your thoughts about this week's assignment?
Okay, so my thoughts on this week's assignment, um, integration of solar panels into hospitals.
Hmm.
Well, okay, my thoughts are that integrating solar panels into hospitals can have several benefits for patient engagement and empowerment, in the sense that it will have cost savings and resource
Yes,
allocation. So what I mean by that is hospitals can produce electricity from solar panels, and they will reduce cost on electricity payments, and then they can allocate those resources towards staff training and buy new advanced medical technologies or equipment, and
right,
then support patient programs, maybe like fund medicals, uh, subscriptions for patients' medications. And then
right.
the second one, I would say it can have a sense of, so this will help symbolize self-sufficiency and resilience. This may help patients feel more empowered, knowing that hospitals are harnessing renewable energy sources to power critical health services.
Okay,
Yeah.
okay,
And then
right. Great.
during emergencies, when they don't have power outrage. So hospitals that are integrating solar panels will be able to supply electricity. Yeah.
Right. Good deal. So, this week we're going to talk about integrating solar panels into hospitals and how it can enhance patient engagement and empowerment in several ways,
Mm-hmm.
and ultimately contributing to overall healthcare outcomes. And so tonight, I'd like to discuss a transformative approach to healthcare infrastructure, the
Mm-hmm.
implementation of solar panels in hospitals, and its direct correlation with enhancing patient care.
Mm-hmm.
So, in our pursuit, now we're going to clean tech, right? And
Mm-hmm.
so, in our pursuit of being healthcare providers of excellent in patient care, it's imperative, to recognize the profound impact that
Mm-hmm.
our physical environment can have on our healing outcomes.
Yeah.
And so traditionally, hospitals have, been viewed solely as institutes for treatment. And
Mm-hmm.
then also, you know, the importance of creating healing environments and conducive to recovery.
Yeah.
So, however, the integration of solar panels and present and presents, I'm sorry, an opportunity to revolutionize this system that we are getting ready to transform to. So let's dive in. Tonight we're going to have a good conversation into how this adoption of solar energy in hospitals is directly contributes to better patient care.
Mm-hmm.
So, here is I'm actually working on a project with Molly, and what they're doing in Mali, they're having like problems. They use like charcoal and wood for
Mm-hmm.
cooking. So now it's causing a lot of respiratory problems there. And so the country director and many administration have put in for a grant to help uh, with this problem. So they're going to like e-cooking. And so I did some more research and, working with the country directors, and we saw where, it will improve environmental stability. And so I got to looking at, I said, wow. So actually, there are hospitals here in the US that's actually doing the same thing.
Mhm.
So, what I mean by improving the environmental sustainability is by, harnessing the power of the sun.
Yeah.
Hospitals can significantly reduce their carbon footprint.
Yeah.
This move is towards, like, I want to say, environmental sustainability, but it's not only benefit our planet, but it's also positively impacts patient health.
Hmm.
And so, what I mean by that is like reduce air pollutions that lead to improved air quality. Just
Yep.
like I mentioned, with the problem that they're having in Mali. And so, I think this is a very brilliant idea. And so, also, I want to say, particularly, it's a vital for patients with, respiratory elements.
Yeah.
So, yeah. And so, and also, I learned, it advanced energy.
Hmm.
Hospitals are the lifelines of during the emergencies, yet, they also have, vulnerable to power outages. Yeah, think about like hurricanes, tornadoes, these windstorms that come through. Generators can only last for so long. And so with solar panels, it provides a reliable source of energy, um, ensuring that, during those power failures, that power supply will be used during this crisis.
Yep.
And so, you got to think about patients that's like, it's crucial for those like in critical patients, care services. I want to say, especially in intensive ICU patients,
Yep.
surgical patients. I mean, it, you just look at Florida. Florida is one of the hard hit states, especially when it comes to hurricane.
Yeah.
And I saw where, hey, they're using it too. So, and also, we can look at it as solar panels can be integrated with daylight, strategies, flooding hospital spaces with natural light. This not only creates I want to say, a more pleasant environment for patients, but also contributes to the positive side of their healing journey.
Hmm.
But hey, also, I did research and I was reading where cost savings it's a good cost savings too. And so, like, you just think about, the cost savings where into patient care. I really believe, and by read according to the research, that adoption of solar energy translates into a significant cost savings for hospitals in the long run.
Hmm.
And by reducing the energy bills,
Yeah.
hospitals can, allocate these funds towards enhancing, more services
Exactly.
and invest in more state-of-the-art equipment. I read also where they have medical devices. We had that conversation
Yeah.
early on, today about, I mean tonight about, they using medical devices with, solar. So
Yeah.
yeah, expanding healthcare programs, and it's just so much. But one thing we have to do, we as healthcare providers, we have to um, educate the community and have community more engaged and empowered about using, about solar panels, and, demonstrating a foster a sense of pride among, patients and stakeholders.
Yeah.
Everybody have to, engage and be empowered to really, encourage that, we, healthcare providers, administration, you know, um, make sure that, hospitals, support this program.
Hmm.
Yeah. And, by engaging patients in, I say, practices and educating them, hospital empower individuals, to take an active role in their own health and well-being. So yeah, yeah,
Yeah, so that they can feel the sense of ownership.
yes,
Yeah, when those programs are
yes,
being
yes,
implemented.
yes, yes. So, promoting innovation, leadership, you know, from my 25 years of experience in healthcare and working in revenue cycle, I say embracing this, um, embracing solar energy in healthcare facilities positions hospitals
Hmm.
as leaders in sustainability and innovation. And it sets, you know, for other institutions to follow suit
Yeah.
and also create, I have learned, a ripple effect that um, benefits the entire healthcare industry.
Hmm.
So yeah, yeah, yeah.
Yeah.
And once we do this will create a healing environment that is sustainable, empowering, and one thing I have learned, we are not only enhance the quality of patient care, but also it's our commitment to healthcare, as healthcare providers.
Hmm.
Yes. And, I'm so glad that, we are as healthcare providers, just the happiness of those who we serve.
Yeah.
Yeah, 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 yes. And so, hey, and so this week, when you turn in your paper, I
Hmm.
like to read, your scholarly research on, towards a brighter, healthier future for all of us.
Yeah.
Yeah, 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 yeah. Hmm.
That's good.
So, do you have any questions for me or?
Um, so when you take the project to Mali, my question was, how are they going to, like the people or the hospitals in Mali, how will they be able to maintain the solar panels?
Well, actually, we're going to train the engineers there,
Hmm.
and it's going to actually be like a hybrid, like a remote,
Hmm.
like troubleshooting or anything else. But what we're doing, we're actually, um, get, promoting jobs there,
Hmm.
with the training, so they be able to, you know, sustain.
Okay. And
So
then
it's more than just installing. It's going to be more. It's jobs. Jobs are being offered.
job creation for the,
Yes, yes,
that's
for
good.
the engineers and hospital administration. So yeah,
Okay, so it means the parts for the solar panels are they going to be imported?
yes,
Okay.
yes. But we're still at phase one.
Okay.
Yeah. So it's just putting everything together and um yeah, so forth.
Yeah, that's a very
But
good
the
project.
yes, yes, but the ideal of this project is to you know um, change lives
Mm-hmm.
and uh, jobs. create jobs.
Create jobs for the Mali people.
Yes,
Yeah, that's good. Job creation.
yes, job creation.
I think they will benefit from the project. They will definitely.
They will. They
Yeah.
will. Yes. So, overall, solar panels into the hospitals can contribute to a holistic approach to patient care, promoting sustainability, enhancing, patient experience and fostering community support and
Mhm.
ensuring, and improving cost effectiveness. And, these factors really will empower patients, all over the world to engage in their healthcare journey,
Mhm.
leading to better healthcare outcomes and
Yeah.
um, a healthier environment, for all,
Yeah.
because all lives matter.
Yeah.
Yes,
That's a good, it's a very good project.
yes.
Yeah.
And so, this is why I chose this topic for everyone to um, do, to write about and do research
Hmm.
and, be able, and I just, want to see your scholarly
Hmm.
research and read it. Yes.
Okay.
And be able to have conversations. Yeah.
I will surely research more on it as we submit my paper. As I
Yeah.
submit my paper, yeah, I'll definitely get more information
Yeah. Yeah. Okay.
on that. So,
Well,
would you like us to like look at a specific location or you just want it general?
I want you to actually go to Google Scholar
Hmm.
and you can, wherever you want. I want to say just a global.
Just a global, okay.
Yes.
So
Yes.
we can.
Yes. How, actually just look at it, if you're in that position, you want
Mhm.
to think, how can I change someone's life?
Mhm.
What can I get? What can I do?
How can I do
As yeah, if you're with a healthcare administrator,
it?
what
Hmm.
can you change lives?
Okay,
Yeah. So,
I got it.
mhm.
We'll contact you for more questions.
Okay.
Yeah.
Well, that will work. And let me end it. Thank you so much for attending. I will share this video with the rest of your classmates. And so I look forward to reading your scholarly
Yeah.
research
I'm
and
looking
come.
forward to it as well.
Yeah,
Yeah.
yeah. So we'll actually get to talk about it on during week 5
Mhm.
and, gather all your thoughts and research and
Yeah.
questions for me. I have questions for you and we'll record this again.
Yeah, we will. Thank you for
Okay.
having me.
All right. You're very welcome. Do you have any more questions?
No, I'm good for now.
You're good. Okay. All right. You have a
All
good
right. Thank
night.
you. Good night.
Right. Bye now.
Bye.